center into a makeshift hospital. This move comes as the Louisiana governor is now warning that hospitals there could soon be well over capacity. CNN's Ed Lavandera is in New Orleans for us, and you were given a tour of this makeshift hospital. Tell us what you saw and what you learned.
Hi, Woeful. Medical officials here in New Orleans hope that the pictures and the images of all of these hospital beds inside that convention center will send a clear message that the worst is yet to come and that the idea of social distancing and keeping away from your friends and family is what's going to make a difference here in the coming days. But inside that hospital, all of this has been set up in the last week. They will begin taking patients, we are told, on Monday morning. Expect perhaps maybe 100 or so on that first day. But each of the spaces, essentially, you know, these squared off hospital rooms. They have a cot. Some have more better bedding, depending on, you know, if it's an elderly patient, that sort of thing. But they are ready to begin taking these patients here soon. These will not be the sickest coronavirus patients here. What they're trying to do is alleviate the pressure on the actual hospitals here in the New Orleans area and turn those into more intensive care unit, people who need the more acute and serious care. And here in the coming days, up and down across the state, they're really bracing for the worst of what is to come here. And the way the mayor is already talking about what the situation is like in this city gives you an idea of just how grim and how dire the coming days will be for this area.
I'm going to bid you. Our coroner's office is at capacity as it relates to our dead bodies of our loved ones. Mortuaries cannot even go pick them up or store because they're out of capacity. I've had to ask the federal government for additional refrigeration so that we can take care of our people while they're resting in God's peace, but not resting well because they haven't been laid to rest as they deserve.
So you can see this is the kind of stress that officials here are dealing with and will be dealing with more intensely over in the coming days. And you know, the state officials, medical officials here are looking at these forecasts about what to expect. And the forecast as it stands right now is projecting here in the state of Louisiana a little over 1,800 deaths because of coronavirus. That would be equal to the amount of people who died during Hurricane Katrina 15 years ago. Wolf?
Ed Lavandera in New Orleans for us. Thank you very much. Joining us now is the former mayor of New Orleans, CNN political commentator Mitch Landrieu. Mitch, thanks so much for joining us. As you know, more than 12,000 cases right now in your state. Clearly, the worst is still to come. Is that what you're hearing?
Well, there's no doubt about it. You know, Katrina is still fresh in our mind when we lost 1,800 of our family members. And so we are very aware of it. This week, the governor and the mayor, the first responders, the healthcare providers are doing everything they can to get ready. But their message is loud and clear that this week and next week we have to brace for impact. The numbers down here are really stratospheric. Our death rate is actually higher than New York's. As you said earlier, we have over 12,000 cases and over 400 deaths. You saw the convention center that has 1,000 beds in it. That's going to be a step-down facility. So we're about to get into the worst of it. It's going to be very, very difficult. People should be prepared for what is about to come.
You're absolutely right, because we did the checking per capita. The death rate in Louisiana makes it one of the worst hit states in the country, only trailing right now New York and New Jersey. So what do you make of that? What do you guys need right away?
Well, we need everything that we've been asking for a long time. First responders and doctors still need personal protective equipment.
Olivia, stop.
Is not really where it needs to be. We do not have the number of ventilators. The governor is projecting that we'll be out of ventilator capacity by April 9th at the rate that we're going. We're hoping that because of social distancing, we won't hit that mark, but it appears, unfortunately, that we will. And as the president himself finally even recognized today, the next 2 weeks are going to be very, very difficult for the people of America. And I would just think that we have to brace for this impact because it's coming our way, and there's not much you can do to stop what's going to occur in the next 2 weeks. But if the federal government is listening, what we need them to do is get equipment to the ground so healthcare providers can save lives. That's the single most important singular mission that they can work on for us.
You've seen Louisiana go through its fair share of crises, including Hurricane Katrina, of course. How would you compare this crisis to what you saw there?
Well, Wolf, unfortunately, we have been to hell and back. Katrina, Rita, Ike, Gustav, national recession, BP oil spill, you name it, we got it. Sometimes we kind of morbidly joke about when the locusts are coming. The people here are really resilient. We're really tough. We have been through more than our fair share. And we'll come out of it, but it's not going to be without tremendous pain and agony. We've been through things like this before. We unfortunately know how much they hurt, what the loss is going to be, what the sacrifices first responders make, and the heroic efforts of the doctors and the nurses. And we're very thankful for that. But we can't hide from the fact that this is going to be tougher before it gets easy. So I don't understand what Vince is talking about when he's already communicating that we're going to get back into stadiums. You need in these instances for our league to have clear command and control, clear coordination, clear communication so that everybody is on the same page. When you have mixed messages, the public hears different things and they don't know what to do, they don't know what to believe, and that makes it worse, and unfortunately it costs lives.
You obviously have seen what's going on in New Orleans and elsewhere. Are the folks there paying attention to the stay-at-home orders, to the social distancing and all of that, or are they not necessarily paying attention and continuing to do what they used to do?
No, I think the people here are doing a really good job. I think everybody has listened to the mayor, they've listened to the governor. They're working really hard. They hear clearly from their local leaders about what it is that they're supposed to do. And I think that they're doing fine. I think that Dr. Birx's admonition today was a good one. Listen to her, listen to Dr. Fauci. Those are the two people who know what's going on. The governor and the mayor and the healthcare professionals have been articulating that message very, very clearly. I just want to be really clear with the public that we have to brace for impact now for the next 2 weeks, because this is going to be a couple of the most difficult weeks that we have had in a very long time.
Unfortunately, a lot of people are going to die, not only in Louisiana, but elsewhere as well, all over the country. Mitch Landrieu, thanks so much for joining us. Good luck to all the folks in Louisiana. Appreciate it very much. Meanwhile, calls to shut down China's so-called night markets have grown louder. Scrutiny has grown over their role as a potential
Joni does not look like Joni no more. She is huge.
Details on these live animal markets.
She's bigger than
You
she's ever been.
That's next. You're in the situation.
I've never thought she'd be this big.
At Papa John's,
Oh, this is huge though.
450-degree oven to box to you.
I think she's off those
It's our
drugs.
policy that your pizza is
Because
never
she's in the
touched once it
church.
comes out of the oven. And we're taking extra steps like no contact delivery to ensure.
Excuse me, ladies. You're Martin Sheen. I live in Fast. I don't know how to help save your family hundreds of dollars on prescriptions with Single Care. Gotta go.
Silver Fox. On what?
Oh my. Excuse me, sir.
Very